everybody. Welcome to the National Alliance for Safe Housing's webinar on safety planning with survivors, presented by Kris Billhardt. My name is Jenny Herget, and I'm the TA coordinator with NASH, and I'll be helping to moderate the webinar today. Online with us, we also have Peg Tailor from NASH and Emily Reamer from Collaborative Solutions, and they're going to be helping to answer some of the questions in chat today. So like Patricia said, please leave your questions in the chat. We'll try to get to them as they come up, but we will be saving some of the questions for the end of the webinar today for a question and answer session. So some of the more in-depth questions we'll try to get to then. If you don't get all of your questions answered, you will be provided with some resources at the end of today's webinar, including the presenter information to get in contact with Kris. We'll also send out some of the resources that she mentions and a link for an evaluation. In that evaluation, you will be able to request a certificate of attendance. So if you do need that, make sure you fill out that evaluation at the end of the webinar. And with that, I'm going to go ahead and let Kris introduce herself and kick things off.
Great. Thank you, Jenny. Hello, everybody. Welcome to the webinar. My name is Kris Billhardt, and I am the Technical Assistance Specialist for the National Alliance for Safe Housing. And I've actually been in the domestic and sexual violence services field for a very long time, worked first for many years as an advocate, then as a supervisor, and then a program manager and director. So hopefully we can provide some information for you today that will fill in some of the learning gaps that you're looking to get filled in. We'll be focusing today on how homeless and housing providers and agencies can strengthen their ability to discuss safety with survivors participating in their programs. And all of this happens, of course, within your COC's system-level protocols around survivor safety. However, that's another webinar. If you have questions about HUD's coordinated entry requirements, we ask that you, as Jenny suggested, type them in the chat box, and we'll be sure to point you to some resources that will help. Okay, so as you know, this webinar is provided by NASH. And for those of you who may be new to NASH, I just wanted to begin by providing a little bit of information about us. We are a project of the District Alliance for Safe Housing, DASH, which is a local safe housing program in Washington, D.C. It's been doing some very innovative housing responses for some time now, and so we're so proud to be aligned in a project of DASH. We are a national technical assistance and training provider. We launched in 2015, late 2015, so almost 3 years now. We have project partners in the wonderful DC Coalition Against Domestic Violence and the Washington State Coalition Against Domestic Violence. Both are entities you may have heard things from because there's great stuff that is going out into the field from both of these partners. And it's really exciting to be part of the Federal Domestic Violence and Housing Technical Assistance Consortium, which we call not DVH-TAC. That's where we started, but now we call ourselves the consortium. That's more user-friendly. And I'll tell you a little bit more about the consortium towards the end of today's webinar. So NASH, as we're doing here today with this webinar, NASH really aims to help communities to work towards increasing the housing options available to survivors of domestic and sexual violence so that they can avoid homelessness in their attempts to live safely. And so as you can imagine, that includes working with the domestic and sexual violence provider system, the homeless and housing system, COCs, and other key stakeholders in doing that work. Okay, safety planning. Let's start off with a simple definition. A safety plan is a survivor's unique strategy designed to reduce the risks generated by a partner's or offender's abuse and control. And there are two key messages embedded in this definition. The first is that it's the survivor's plan. And we'll talk about that a lot, that it's got to be very much directed by the survivors and the survivor and their unique circumstances and strategies. The other message embedded in this definition is that safety planning doesn't and can't guarantee safety. So it's not ironclad. Once you have a safety plan, it doesn't mean that there aren't still going to be risks associated with the experiences that you've had as a survivor. So even the best plan can't control an abuser's choices, which is why it's not ironclad. What it can do is really try to identify the areas that are going to be key to reducing the abuser's opportunity to make choices to reassault or cause harm. So this slide could almost be titled Safety Planning. It's not just for domestic and sexual violence programs anymore. Though the concept of safety planning has been always a core element for domestic and sexual violence advocates, it's really clear when we look at the intersection that homeless and housing providers need to embrace it as well. So here's just a few of the data points as to why that is. We know that the large majority of women and children experiencing homelessness have experienced domestic violence. We also know that 50% of sexual assaults take place within a mile of the victim's home. And that means that the neighborhood may no longer feel like a safe place. If this is somebody who's in your housing when a sexual assault occurs, there may be danger issues and safety issues that are popping up all over the place for that survivor. So it's good to be able to know how to have that conversation. Also, sexual assault impacts in many, many ways, and those trauma impacts can compromise a survivor's ability to remain in their housing in the aftermath of an assault. So relocation may be necessary, which may bring them to your program. We also know that leaving a domestic violence relationship can actually heighten the danger. Even though we encourage folks to leave to get safe, there's a period of time after leaving that is actually very dangerous for the survivor and their children. So it's really important to be attuned, even though we might think, okay, they're gone, everything's safe now. That's not necessarily the case. And we also know that talking through a plan can really help a lot in identifying what those high-risk situations might be, those places where we might be able to mitigate the danger and reduce opportunity. This can also really promote survivors' ability to more fully participate in your program and work towards their goals. So having a safety plan benefits everyone when they're in your services. A little bit of fine print. Domestic and sexual violence advocates usually conduct a risk or lethality assessment as part of the safety planning process that they do. And this requires a lot of training and background in the dynamics to be able to thoroughly and confidently talk to survivors about what the assessment shows their risk to be. So that kind of very in-depth safety planning and risk assessment is best left to victim services experts. So you'll hear me talk about partnering quite a bit today, and that's one of the reasons. Homeless program staff, though, should be equipped to discuss safety as it revolves around survivors' participation in your services. And also, of course, to know when and how to provide referrals to domestic and sexual violence programs for more in-depth planning. Okay, so some examples of working together safely. Some of the elements might be things that you need to be thinking about and talking over with survivors around information sharing that you customarily do when you have somebody in your program. What does that consist of, and does that present any risks or potential dangers to the survivors? So you'll need to talk all those things through around safety. Safety of the housing location. The unit that you have open and might have in mind for the survivor might not be in a safe place for the survivor to locate based on it being nearby where the abuser works or lives, or requiring going on a bus route that the abuser typically takes. There may be all kinds of reasons that that housing location you have in mind is not going to be a good fit for the survivor. So talking that over is going to be an important part of your safety planning. Safety connected to the work that you're going to be doing together. Do you do home visits? Do you work out in the community, or will you be out and about together with the survivor at all while they're in your program? How can you assure that you're building in as much safety as possible to conducting those meetings and check-ins and appointments? Thinking in the kind of detail around things that sound simple, like leaving a phone message or sending texts. Does the abuser have access to the password for somebody's phone? Is it going to be safe for you to communicate electronically, or even just leave a plain old voicemail for someone? So talking that over and making sure that you ask questions about that is important. And again, as I said, if you're out and about or working together out in the community in something other than a private location, how does the survivor want you to handle being seen by somebody they know? How do they want you to explain who you are, why you're together? So talking that out ahead of time is better than trying to fumble through it when it's occurring. And then advocating with landlords. Sometimes disclosing a DV history can be very helpful to a landlord who's very skeptical about somebody's prospects as a tenant. If there are damages or evictions in somebody's rental history, it can sometimes help a landlord open their eyes to why that might be a less than stellar rental history, to know that domestic violence has been part of their life. But this kind of exposure is not always welcome and is not always helpful to a survivor. So once you've got the dynamics of domestic and sexual violence kind of down and you want to be an educator with a landlord, you would be exposing somebody's personal history if you just took it upon yourself to have that conversation without checking it out with the survivor ahead of time. So those are some examples of things that might come up when you're working together with a survivor. Now let's first focus in on some policy, practice, and effective approaches. And so the goal here would be for all homeless and housing programs to take a thorough look at whether their intent to promote safety is fully aligned with how the agency enacts its services. So thinking those things through, is it a good fit? Conveying your priority and your focus on safety early in your contact with survivors is really best practice. What you talk about and how sends lots of messages to people. We always say information is power. Information can be very empowering to have. And so being transparent and providing clear information about how things work as you work together with a survivor can really help settle somebody who may not be dealing, who may be dealing with trauma impacts. We'll talk about that in a minute. Bad experiences with systems, and then the daily unpredictability of surviving domestic violence and sexual assault. So explain what your obligations are, along with explaining the options available to survivors in line with that. And when there is a disclosure or an indication of domestic or sexual violence, start talking safety. So your commitment to safety is also conveyed in how you do things. And I think it's important, you all probably know this, you've experienced it. Assessment is really a two-way process, right? Survivors or your participants are assessing you as much as you're assessing them and their circumstances. And survivors are assessing how much they can trust and how safe they are with you. So here are some basic best practices that I know can be challenging, but might make a crucial difference as survivors assess whether or not to disclose, how much to share about the context of their reasons for seeking help, etc. So really looking at your physical space in which you have those initial conversations. Is there privacy? If you can arrange more privacy, a door that closes, or at least a white noise machine, something that better ensures that there's privacy when you're talking in those early stages. Well, always, but especially when you're first making your first impression. Conducting separate interviews with couples can be a really, can be maybe the only way sometimes that survivors may be able to acknowledge that they're living in a dangerous relationship or their household contains somebody who's scary to them. That could allow you to then provide a different housing response than if you work with the couple together at all times. It might not allow the survivor the space and the safety to disclose what might really be going on. And again, your local domestic and sexual violence experts can help you in sorting out those power dynamics. And so we hope that you'll be looking to them for consultation and training. And then the other thing that's very much best practice is including a brief domestic violence and sexual assault risk assessment with everyone who comes into your services. That can be 2 or 3 questions that really assesses from the gate what the circumstances that person might be dealing with are around their housing. And that can really help you know whether there needs to be an emergency response because the danger is immediate, or it can also give you some cues about whether your protocols should kick in. So understanding trauma and trauma-informed approaches is, again, a whole other webinar. But we need to touch on it today. I don't want to give it short shrift because it really deserves a lot of time and attention. But I do want to just do a quick overview because it's a huge part of working effectively with domestic and sexual violence survivors. So here is just some of what we know about trauma. We know that it's huge and pervasive. Its impact really shapes many different arenas of somebody's life. So it's not something that you can easily compartmentalize and have it not invade all the areas of your life. I'm just seeing that the audio is low, so I'm turning myself up. I hope that helps. It also, trauma differentially impacts marginalized and vulnerable people. It may recur within families and communities across several generations. It's also known as historical trauma. And then when you have historical trauma and you have ongoing oppression, it's really not historical, it's present. So it really exacerbates the impact of the historical trauma that somebody that you're working with, or maybe you in your own life are working with, when you have those ongoing experiences of oppression and discrimination in your present day life. We also know that the service system has often been re-traumatizing with survivors of domestic and sexual violence. Often that takes a form of what we call victim blaming, where the service provider may hold the victim responsible for their own victimization because they didn't do the right thing, they didn't respond in the right way, and that can be very re-traumatizing. And trauma impacts how people approach services. So that's why we want to be very tuned into it when we're the service provider. So just a few data points about the impact of trauma and the pervasiveness of trauma. It's very extensive, and when we look at trauma and particularly in women, this 2013 report from the Substance Abuse and Mental Health Services Administration found very high rates of violence history in women seeking support from many of the different systems, the entire spectrum of public health services, safe housing, education, employment assistance, family welfare supports, very, very high rates of violence histories among women. And of course, the study was particularly for women, but we can't ignore the impact that trauma has on men as well. We also know that domestic violence, when you're living with it on an ongoing basis, It's overwhelming to people's ability to cope, and it's life-threatening in many instances. And this creates, walking around in this kind of atmosphere every day creates a toxic level of stress, which can create all kinds of physical impacts as well as emotional and psychological impacts. One study that I was part of here in Portland, Oregon, called the SHARE study, which was funded by the Centers for Disease Control and Prevention, found in the group of survivors we were working with in the study in our housing program that over 94% experienced PTSD. And the average score was higher than that, equal to or higher than that of a returning combat veteran. So it's very extensive and you know, very, very noteworthy. And survivors' sense of power, their self-efficacy, how well they feel, the quality of life, their sense of well-being are very diminished by the trauma that they experience. And of course, that affects all areas of their lives. So in terms of how coping with the impacts of trauma may show up in someone's behavior, this list on the slide here is just a partial list, so I don't mean it to be all-inclusive, and it shows up differently for people and differently at different times in the same person. And I think one way to relate to this is if you think about times of crisis in your own life, you may really recognize some of your own experiences or behaviors on this list. So a time when you were dealing with a traumatic situation or some kind of crisis in your life, you may have been a little bit emotionally uneven. It might have been hard for you to think things through and concentrate on things. You might have been having trouble sleeping. There might have been nightmares. You might have had too many extra drinks to try to cope with what you were experiencing. And then sometimes just zoning out, being withdrawn and not wanting to contact friends or talk with people and so forth. So this is, again, just a partial list, but these are some of the ways that trauma may show up in people's lives. And so thinking about those impacts when somebody is participating in your services and coming into your program or working with you ongoingly, stepping back and looking at how somebody dealing with all that might be experiencing your process can be really eye-opening. So I know it's not news to any of you that many of the people who seek your help with are dealing with the impacts of trauma. There's many different sources of trauma in the lives of the folks that we may encounter in our services. But with victims of domestic and sexual violence, it's pretty much a sure thing that trauma is kind of coming in and sitting down with them when they start talking with you. So if you haven't already, that stepping back is really critical, examining everything you do as to whether it aligns with a trauma-informed approach. So how would somebody experience your intake process, those very early stages of working with you? Is it very rushed and obviously trying to meet the goal of, finishing the paperwork? Does it ask a lot of detailed and intrusive questions? Are the folks that are asking those questions trained to tune into signs that something that they're talking about might be triggering triggering a trauma reaction in the person that they're talking with? Do you spend time kind of trying to know the whole person, establishing rapport before diving right into the business at hand? Also, is there a possibility that you can allow for pauses, make a second appointment if it's too much to get through the assessment or the intake in that very first appointment? Can you offer to have the person bring in a support person who can help keep them grounded during that process? This is, as I said, is just a very quick overview of some of the things that you might be thinking about when you assess whether your process is trauma-informed. So I don't mean for this to be all that you need to look into or all all the possibilities that you have at your disposal. There's lots of good information about trauma, and we also hope that trauma training is part of what you do to help shore up your safety planning with survivors. So, never ask a question if you're not ready to deal with the answer. So as you're trying to create an atmosphere that creates safety for survivors, you might find that more survivors begin to disclose the domestic or sexual violence. So your agency should be ready to respond to survivor safety needs. And this may look very different from program to program because ideally it's tailored to your community and its resources. But in all cases, there are some basics. If the danger is identified as current and immediate, you need some immediate options that you can offer to survivors around safety. And this, again, could involve a partnership with your local domestic or sexual violence program to see if they have resources that can be brought to bear. But just thinking about what kinds of immediate options your agency might be able to provide is an important part of your safety planning protocol. In all cases, you offer informed consent, an informed consent process where you, as I said earlier, explain the information you're going to be needing to gather, where that's stored, who gets to see it, all those kinds of things, and ask about whether that poses some safety concerns. Offer linkages to support services that are out in your community, priority placement, and then, of course, safety planning. So despite doing all that you can to create an atmosphere of safety so that survivors can lower their guard and trust that they can disclose about violence in their lives, survivors may not open up about it right away. They may have many reasons not to disclose, including bad experiences with systems involvement, as I referred to earlier, fears that sharing what they're going through or have experienced could result in them being denied services. There are sometimes survivors who have tried to seek housing help from the domestic and sexual violence system and that system hasn't had housing resources, so they may come to the homeless housing system and fear that they're going to be sent right back over to the domestic and sexual violence system if they disclose. So that there's, again, that conversation and information giving process that should be part of your explaining how things work in your agency. Fears around immigration status. Is that going to be, if they're open and share with you what's going on, is that going to, or any kind of openness, is that going to expose an immigration status that could result in fears around deportation? There may also be lived experience with systemic racism and discrimination that keeps people from sharing what's really going on for them. And also fear of potential child welfare system intervention if they describe violence in their lives. So there are many more reasons that survivors may kind of play their cards close to the vest, as they say, and not disclose. So more may be revealed over time, and you might find that domestic or sexual violence is an issue after somebody is in your program, after they are housed. If that's the case, then these things are very important. So don't judge the survivor for not having disclosed earlier or for choosing to want to stay with the abuser if they're in the housing together. And that can be a tough one because we tend to think that the solution is just to go right straight to bifurcation of the lease, and that may not be what the survivor is wanting. So it's really important to hold back any judgment you have about what you think the answer is. Sometimes the abuse comes to your attention because other people complain about the tenant. And when you do get a complaint like that, confidentiality really needs to kick in. So you can assure the complainant that you're going to be following up, but you certainly don't follow up with getting back with a lot of details. And when you do that follow-up, the conversation and how safe you can make that is really important. So separate meetings with the couple when you do the follow-up. Of course, you enact your agency policy in concert with all the legal protections. If the abuser leaves, we think it's really best practice to help them with a new housing placement so that they're not lurking, trying to get back into the unit, and creating ongoing problems for the survivor. And if they leave, we don't want, you know, the safety plan that you come up with the survivor to result in anybody becoming homeless if at all possible. So help the abuser with a new placement, and also help the survivor to determine the best safety strategy if the abuser does depart. So again, I'm not going to dive very deeply into the Violence Against Women Act protections today, but many people in the previous iterations of this webinar had lots of questions about those legal protections. They were very VAWA curious. So now is a good time to present just a very brief VAWA primer. First, it applies to anyone who is a survivor, either actual or perceived, regardless of sex, gender identity, sexual orientation, disability, or age. It also can provide protections to affiliated individuals of the survivor. And those might be individuals who are not on the lease but are in the survivor's immediate family, or an individual living in the household. VAWA covers many different forms of publicly funded housing, including public housing, housing choice, Section 8, project-based Section 8, home, housing trust funds. You recognize a lot of these funding sources. McKinney-Vento Act programs, including ESG and continuums of care. So may apply in most cases to survivors that you're working with in your programs. And these are some of the rights that comes through VAWA 2013. VAWA survivors have the right to not be denied shelter or housing based on a domestic violence history. The abuser can be removed from the unit. You can port Section 8 to another location. You can seek an emergency transfer. It goes on. That's why I said there's a whole webinar on this, and you can probably access that through our Safe Housing Partnerships website we'll talk about later. Survivors have the right to stay in the unit, even if there's criminal activity that's related to the DV. Confidentiality kicks in, and there's also a self-certification process that HUD recognizes. So those are just some of the aspects of the legal protections that you may need to learn more about if abuse does get discovered when somebody is in your housing. Okay, and so we're not going to get too deep into the weeds of programs' individual policies and procedures, because that really varies a lot across programs. But some general rules of survivor-friendly and best practice policies that you can measure your policies against. Safety planning at all stages, reducing or eliminating mandates wherever you can. A voluntary services model is best practice. Building in as much flexibility as you can so that you can really tailor your response to the survivor household, and make sure that things are clearly written in your policy so that staff can consult the policy if they have questions. Some additional considerations in terms of policy and matching your intent with the impact. It may sound like a good idea, but it's not, to require a protection order. First of all, that's a violation if you're requiring a survivor to get a protection order when you don't require all of your tenants to do that. But also the legal system and involvement with that whole kind of response that might be available, that is available to survivors, is not for everyone. Again, there's systemic racism in those systems. There might be fear of deportation. In addition to that, it may also not be very protective for some. It can serve to provoke reassault when the abuser is served with order to stay away. That can sometimes assault the abuser's sense of power and control, and it can result in bad actions. Never bar the survivor from contact with the abuser. And that's, again, it might seem like a good idea, but it's really not in many cases. The survivor may need to have contact with the abuser. There might be required visitation, court-ordered visitation, and they have to exchange the children for that, or be in violation of a court order themselves. There may be some dependency on the abuser for child care, for money, for transportation. It's sometimes also a way that survivors have learned they can appease the abuser. If I just see them every once in a while, they don't get as angry and as in need of control in my life. And sometimes survivors want to continue to have contact with an abuser, but so they can maintain the relationship or continue to kind of scope out the relationship and whether it's a good idea for them, but from a place of safety, from their own space. So never bar a survivor from contact with the abuser. Never expect the survivor to control the abuser's behavior. So this whole phrase that I've heard, failure to control your guest, that's really not something that survivors have had control over ever. So expecting survivors to control the abuser's behavior around things that might happen in the unit is not matching intent with impact. Okay, time check. I think I'm doing okay. Preparing staff and engaging partners. Moving from the policy level, let's look at some further aspects of readiness to serve survivors effectively, including training and partnerships. The agency culture is that overarching atmosphere, the backdrop in which services happen. It's important really that the whole agency is attuned to survivor safety, not just some pockets within the agency. So from reception staff to management and board, it's important for the agency culture to be imbued with a trauma-informed way of seeing the work. If just select staff are focused in on these issues, it's possible that they may not receive the support they need to support survivors, and so there may be pockets of understanding and comprehension and getting all these issues. But that could result in a very uneven experience for a survivor. Active partnership with content experts, you're hearing that from me multiple times today, and expect staff to adopt the safety-related policies. Ask them to follow the protocols and make sure that there's accountability around that. Okay, I'm not going to break into song, although I might have already planted an earworm in some of you who know the song this title is based on. Sorry about that. But ensuring that staff have the tools and the confidence that they need to work safely and sensitively with survivors really does boil down to some fundamentals. Training in domestic and sexual violence dynamics, training in trauma impacts, and then having those great connections to content experts. So again, did I mention how important partnering is? Even once all the building blocks are in place in your organization, an ongoing relationship with victim service agencies is important. For one thing, they can help you bring in the training that you need and keep it fresh. We really don't want it to be a one and done. Okay, we did our domestic violence training 5 years ago, so we're set. We have turnover, there are changes in the ways that the resources are available in your community. So keeping that training fresh and offering it on an ongoing basis is a great practice. You can also often establish agreement with your partner agencies that you can call on each other to tap into each other's primary expertise. Domestic and sexual violence providers need to know a whole lot more about the housing world and vice versa, so it can be a really good cross-training prospect. There are also co-location models. You can do co-case management, and that can work really well when you're working with survivors in your housing program. So here's a whole bunch of other potentially helpful community partners that you might have in your community. This list can look very different from community to community. Some of you may need to be more reliant on state coalitions or organizations, or the next community over, or national TA providers and resources. And again, as I've mentioned, not all of these resources are experienced as helpful to all survivors, and have actually been re-traumatizing to some survivors, or not seen as a resource at all for some survivors. So these aren't presented to convey that a connection to all of them should be standard for all the survivors you work with, but these are just some of the ones that might be helpful for you to learn more about in your community. Now to some nuts and bolts. With your victim-sensitive policy, your attention to agency culture, and your training all in place, let's move to a look at some of the basics about safety planning and practice. So setting the stage for safety-focused conversations, here are some things to keep in mind. Domestic violence and sexual assault are complex issues, and the wrong intervention could lead to harm. So this is a way to say don't wing it. Remember your experts. One of your biggest experts is the survivor that you're working with, but you've also got your partner agencies. Manuals and toolkits and webinars like this one are really no substitute for the live interactive training. It's a key ingredient to have on a regular basis. Ensure meaningful language access. This isn't just for survivors, this is for all the folks that we work with. Nuanced and stressful conversations are really hard if they're not in your first language. And this link in the slide that you see here can help you look at developing a language access plan if you don't have that in place. And then again, remember, it's the survivor's plan and not yours. So you really have to honor survivors' preferences and also cultural considerations when you're working with individuals and households. And just to underscore the importance of being prepared to address cultural differences, here's just a brief snapshot of what we know about the composition of those experiencing homelessness today. Many of you probably have already become familiar with this study done by the Center for Social Innovation SPARK project. If you haven't seen it, there's a link on this slide and you can go and upload it. Basically, they did a pretty extensive examination in 6 communities around the country and found that predominantly people experiencing homelessness were people of color, and way higher rates of that than in their representation in the general population. Also way higher rates than poverty rates would explain. So we definitely see lots of indications of systemic racism, oppression, lack of equity across many sectors in our society. So remembering that that is a huge issue, that cultural consideration and how you provide your services and the degree to which you give weight to the lived experience that people are coming in with is a huge, important consideration. So a review of our assumptions. You're going to be proactive. You're not going to wait for disclosure. You're going to do everything that you can to demonstrate safety is a key concern, to create the right atmosphere for survivors to come forward with what's going on for them. You've got the training in place, and most important about the training, and the content is very important, but helping people feel confident that they can discuss safety and plan for safety with survivors is key. You're going to be very transparent about data. You're frank about what you have to collect and how it's stored and the options that you can offer to survivors around that. And you've really worked to look at suspending judgment and rooting out victim blaming. And then you're going to be routinely applying a safety lens when you're working with survivors. So these are some great safety planning. There are some really awesome safety planning tools out there. Your local program or state coalition probably has a favorite, one that they can recommend. There's many of them on the web. But what I really want to underscore here is that first, your scope will be more limited than a domestic violence expert's scope, unless you are a domestic violence expert. So you're focusing really on working together safely. And the other piece that I really want to underscore is that the best safety plan is not a checklist. It's organic. It's very conversation-based. So thinking about a checklist may be helpful in terms of knowing some of the areas that you want to be sure to talk with the survivor about. But it really is a conversation rather than a form that you want to fill out together. Bring the concept of safety into the room in your first interaction. Opening questions like these can help gauge whether domestic or sexual violence may be an issue or relationship dynamics may be an issue, and it can also send the message that you're a person or an agency tuned into safety dynamics. So starting with, is our location safe for you? Bringing that very basic question of safety into your opening line. Are you safe to sit down and talk for a while? Is there someone here today who makes you feel unsafe? And then talking with somebody about whether they can leave safely. So not making assumptions that because somebody has plunked down in your office, they're free to leave safely or to talk with you safely, and really examining that from the start and sending all those messages by asking those questions. So survivor or safety planning is not only survivor-led, but survivor-defined, and we really want survivors to be able to define what safety means for them. It may be very different from the way we understand it or what your ideas might be about what's going to help them be safe. So you want to be able to look not just at the domestic or sexual violence and the danger that that might pose, but what other life-generated risks might be part of what that survivor is working with. Again, honoring survivor preferences and cultural considerations, and building on survivors' expertise of the abuser's tactics. They know a whole lot about potential reactions and choices and so forth based on their history with that abuser and watching them so closely and knowing them so well. So it's around partnering to understand what the survivor's perspectives are. And safety planning should also include thinking about the children and looking at the children's safety as well. Safety planning may be so intuitive to survivors, something that they don't even think about, but it just happens, that it might be tough to kind of break it out and talk about it. So you can sometimes kick off a safety planning conversation by naming some examples that you've heard of what that might look like. And again, remembering that these are not imperatives for every survivor, and some survivors say, I'm not going to call 911, but others really need to have that 911 cell phone, even if they can't afford a cell phone plan, so that they can call for help if it's needed. And so the survivor should always be asked, do you think, some survivors do this, do you think that this would work for you? Or what do you think would be helpful for you? These are just some of the examples of the kinds of things that might be part of a safety plan. Remember that, again, survivors know a lot about how to survive, but we don't use that word for no reason. You can show that you know that by partnering with that expertise and pulling out some of those pieces. This can also, naming those things and talking with you about them can help the survivor really restore a sense of control and efficacy in their life. So there are things that you have done. There are ways that you've noticed what might be about to happen. What are those things and what have you done in the past? And then, of course, checking in on the survivor's sense of safety while in your program or in your housing. Safety planning is tailored to the survivor and to their situation. So plans may look very different in these different circumstances. A safety plan when somebody is separating from a partner might include things like not telling the partner you're leaving, because that could trigger some need to control the situation and possibly result in an assault. Safety planning will look very different, obviously, when you're co-housed with your partner and you want to continue to do that. That might mean making sure that you have connection with a support network and you have somebody that you can reach out to and talk with if you need to, and you know what the resources are. If you're living separately from the partner, it might be very different based on whether the partner is stalking, whether the partner is in jail. That plan might be very different. And then survivors of non-intimate partner rape or sexual assault may have a very different set of issues to look at. There might be ongoing issues around the courts. This could be true with intimate partner violence as well, but medical issues, trauma issues, and different aspects of whether it's safe to live where you are right now after rape or sexual assault. And then, of course, children in the household is a really important part of tailoring the focus of the plan. Connecting with survivors, not just about physical safety, but also about emotional safety, really demonstrates that you have some grasp of the full scope of what they're dealing with. So these are some ideas about how you might address emotional safety when you're working with someone. Just having an open conversation about trauma can be really helpful. So has that been happening for you, and have things happening that have been triggering, and let's talk about, what you might be able to do for yourself if that's happening. When you know that a survivor has a situation coming up that's going to result in potentially seeing the perpetrator in public, such as having to go to court or contacts around child care or child visitation exchanges, you can talk ahead of time about self-care responses and how the aftercare can look when that emotional experience occurs. So final tips. Safety planning should be your protocol, but remember that it's voluntary for the survivor. So a survivor can choose not to have that conversation with you, even though we've been talking for almost an hour now about having that conversation. Remembering that that's the survivor's choice is important. So if the survivor declines to enter into that conversation with you, you can, state that you certainly respect that choice, but if that person changes their mind, you're still available. Here's a hotline number. Here are some other resources I just want to make sure you have. So respect the declination, but try to keep that door open. Always ask the survivor if writing things down would be helpful. We talked earlier about trauma and how one of the impacts on trauma can be forgetfulness and losing details sometimes. Sometimes writing things down can be a good trauma-informed response, but it needs to be kept somewhere where it's not going to be a safety risk to the survivor. So talk openly about that when you are devising a plan together and want to make sure the survivor has those aspects of the plan in mind. Never include details of a safety plan in client documentation. These records could be exposed in court action or through other networks that an abuser may have, and we don't want the abuser to have advertently or inadvertently a mechanism to find out the details of a safety plan. So we don't want, the survivor is living at or staying with this friend or receiving services from this agency could really expose somebody's location or the details of their plan. So you can indicate that the safety plan has happened in the client chart, but do not put the details of the safety plan. And that might mean you might have to have some internal communication if you work as a team so that everybody on the team knows the details of the plan, but it's not in writing in the client file. Always offer connection to the local domestic and sexual violence agencies and culturally specific resources so that the survivor is empowered by having those resources, whether they access them immediately or not. And again, leave that door open because we know that trust might take a while to build, and people often scope us out, we scope other people out to see down the road whether we might trust them with a confidence that right now we're not so sure about. So keep that door open. So after today's webinar, we hope that you, if you don't already have a great connection with your domestic or sexual violence partner agency in your local community to help training and guiding and working together with your staff, we hope that you'll make that connection and start cultivating those relationships. We also hope that you'll consider requesting technical assistance from NASH or from one of our consortium partners. And then I'd like to tell you about some other resources that might be helpful. Here's this website that I referred to earlier, safehousingpartnerships.org. It's the website for the consortium, and it is chock full of some very comprehensive information about the intersection of domestic and sexual violence and homelessness and housing instability. There is lots of data, there's literature reviews, there's graphic stuff that can be very helpful. There's a wonderful little 3-minute video that talks about the intersection that's really helpful to use sometimes in trainings or in education that you might be doing. Lots of great information there. So if you haven't already discovered Safe Housing Partnerships, we hope that you'll go to that website after today. And just a little bit more information before we move into Q&A about the consortium itself. So the Domestic Violence and Housing TA Consortium consists of the support and the backing of 4 federal agencies. It's really kind of unprecedented for this level of collaboration among federal agencies to see a project like this get launched. So the Family Violence Prevention and Services Program through Health and Human Services, the Office on Violence Against Women through DOJ, the Office for Victims of Crime also through DOJ, and the Office of Special Needs Assistance Programs, SNAPS, through HUD, have all worked together to collaborate amongst themselves in order to help support a very comprehensive resource provision to the country on these issues. And the 4 technical assistance providers that are part of this consortium consist of NASH, the National Alliance for Safe Housing, yours truly, Collaborative Solutions, and we actually have Emily Reamer from Collaborative Solutions on the call today, so she might be able to respond to some of your questions. They've been a HUD provider for a long time, a HUD TA provider, and so really know a whole lot about what HUD's requirements and what you're working with in terms of being responsive to HUD's concerns. And the National Network to End Domestic Violence, and NEDV, which is kind of the national coalition of coalitions. They've been extremely helpful and supportive to domestic and sexual violence coalitions throughout the country for a very long time, as well as tribal coalitions. And then the National Resource Center on Domestic Violence, which is one of the resource centers funded through HHS to provide comprehensive support and help for domestic and sexual violence providers and stakeholders. So that's the consortium. I seem to have lost control of the slides. Can somebody advance to the next slide for me? There we go, thanks. So NASH can provide, as I said earlier, training and technical assistance to you or your community. We can provide system-level TA, program-level TA on a number of issues, including the ones that you see listed here. Still don't have control over the slides. Thank you. And we wanted to let you know about these upcoming resources that are very close, one of them in particular, very close to being available to the field. Safety Planning for Survivors of Domestic and Sexual Violence, a toolkit for homeless housing programs, which will take much of the information that I've shared with you today and expound on it so that you have way more information about dynamics and resources and practical tools. And then there will be a companion document to that safety planning toolkit that helps on the COC level to look at safety planning and some of the coordinated entry requirements around that. Okay, and now I believe we are ready for Q&A. Oh, no, wait, upcoming trainings, sorry. These are just a few of the offerings that are coming up in this next few weeks. We've got some deep dives about safety planning, which is a chance to have kind of more of a conversation-based exchange about some of these issues. So if you've been curious to engage more with this topic, you might consider that. We've got some things coming up that are part of the consortium's NOFA webinar series. More deep dives around flexible funding. Then we've been doing a best practices coordinated entry series, and so we've got some of those coming up as well. Now I believe it's time for questions.
So with that, I'm going to go ahead and let Peg moderate the Q&A here. We've got a couple of questions that have come in from folks. So Peg, go ahead and let you jump in.
Yeah, sure. So, Kris, we did get a question in the chat box, and actually, Emily, you might be a good person to field this too. Sarah Watson asked a HUD-related question. She says the local housing office is strict with documentation specific to PFA orders. However, VAWA says PFA is not the only documentation other than education. How do we get housing authorities to improve their response to survivors and understand the lethality? So do either of you want to try to field that?
Emily, you want to take that one?
Yes. Well, I can certainly say I think it's a million-dollar question, right, in terms of I think what you're speaking to is the advocacy that's needed to help your local housing office understand what's required and what are the safety implications. I'm concerned I'm not following the question, but the latter part of how do we get housing authorities to improve their response to survivors. I think Kris touched on the importance of relationship building and being at the table, help educating them. I don't know what that looks like in your community, or if other folks want to talk about what that has certainly looked like. Is that, I don't know if we can unmute Sarah to talk about which local housing office, or if other presenters have something they want to chime in based on the question that she has there.
Emily, that actually
Sarah,
might be a... Oh,
I'm sorry, go ahead.
Say we have a really good opportunity for the deep dive that's going to be coming up. It's going to be a little bit more participatory, so that might be a great time to get into the specific local question.
That's a great idea.
Yeah.
And also, I was going to just suggest that There are a number of different kinds of documentation that housing authorities are allowed under VAWA to accept as documentation or evidence of abuse. It doesn't have to be a stay-away order or, say, police reports that survivors are allowed to self-certify to abuse that they may have experienced, or a letter from an advocate is also, according to HUD at least, sufficient to provide that documentation. So there are a variety of ways around that, but I think Emily's right that advocacy is going to be sort of reaching out and developing that relationship and providing the education as well.
And I certainly think, thanks for that reminder, Peg, about the letter being sufficient documentation, and there are other options as well. VAWA, I think for those of you that are HUD and COC grantees, we still have a lot to learn and implement more effectively related to just VAWA, the law, and related implications for those of you working with recipients of HUD funding. And so, Jenny mentioned some deep dives coming up, but we could get into sort of the nitty-gritty of your community, as well as the consortium will be putting out, some very targeted TA on VAWA, because we know that communities are running into a variety of obstacles in implementation.
Right. Okay, so go ahead, Kris.
I was going to say, I think some follow-up TA, we could maybe connect Emily or somebody else from Collaborative Solutions with Sarah and that community to get more into the details of what's going on and make a plan.
Yeah, Sarah, I am putting my, it's on the presentation, but I'm also putting my email address in the chat box.
Fabulous. Kris, there was, we had a few questions here. One was, if survivors are so traumatized that they can't ensure their own safety, then why isn't it a good idea to require a protection or a stay-away order? So I guess the implication is that, trauma might make it difficult for survivors to understand and protect themselves from the threat they might be facing. So how do programs then make sure that their communities are safe?
Well, I think that, there's a lot to unpack in that question. As I said earlier, this is a really complex issue. And so I think, for one thing, I wouldn't want to make an assumption that somebody isn't a good judge of their situation. Trauma can certainly get in the way of, communication and comprehension of circumstances and all that kind of thing. So it could definitely be that the trauma-informed response needs to precede any assumptions that they're not a good judge of how safe they are. So I think bringing some resources to bear and making some suggestions about some ways to have that conversation in a deeper way, possibly with your, local domestic or sexual violence program working in partnership. You can do a consultation with a DV or SA partner and leave identity and personally identifying information out of it so that you can really walk through the situation with someone and they can hear more details about what's been going on and why you're concluding that that survivor is not a good judge of their own safety. Regardless, I don't think that the answer, even if they're not being a very good judge of their safety, and by some objective measurement, that requiring a protection order or a stay-away order is the answer to that. I gave some of the reasons for that during the presentation. There might be all kinds of reasons that's not a good idea for somebody. Just presenting to the justice system might be very traumatizing itself to have to go to court. The survivor, again, cannot control the abuser's behavior. So expecting that a protection order is going to be controlling that behavior any better is kind of a false expectation. And in many cases, as I said, it really can just exacerbate the situation when the abuser is served with an order and feels affronted by somebody trying to take control of their life when they're all about control. So that's a complex question, and there's no easy answer to it. So thanks for the question. But you know, regardless of whether they're a good judge or a not good judge, requiring a protection order is not necessarily the answer. And again, unless you're requiring a protection order of everybody who is a tenant or a recipient of your program services, it's really a violation of the law to require one tenant to do that when you're not requiring that of everyone. So there's lots of reasons to stay away from that being the answer. And I'm happy to let, you know, Peg or Emily amplify that or make other points that I haven't thought of.
I don't have anything to add. Emily?
I do not.
Yeah.
Okay.
So we had a question from Stephanie Love. She says, where does one direct a survivor if a landlord is not respecting their rights directly related to DV?
Is that okay if they're not, yeah, this is one of those where I'd have a million questions, and it might be a good TA call to find out more. Emily, do you want to jump in with what you know about, you know, kind of the generic response to that?
Sure. Well, I guess similarly, I would want a little bit more information about, you know, is it a private landlord? Is it a subsidized unit? You know, essentially what funding is attached to that unit, and therefore then, you know, what compliance is required for that landlord to respect. I think, you know, I'm a clinician by trade, and so I think certainly getting in there and, you know, finding the shared objective of both the landlord and, you know, whoever the advocate or the case manager is, it is to keep that person safe in their home and to keep that property safe. And so really focusing on what things need to be in place to reach that shared objective and moving away from how do we define, you know, how the landlord defines DV or how the landlord defines rights, or, you know, that can certainly, those are all important discussions, but I think to really get to the meat of it is focusing on the landlord with, you know, you are here to help this tenant maintain permanent housing and for the landlord to have a safe property. Coming at that angle I have seen be very effective. And then of course, you know, if there's just pure disrespect from the landlord and there's you know, sort of a human right issue at hand, then I think it's pulling in again whoever's attached to that funding. So that could be, you know, whether it's HUD field office or whether it's the city department of health, or you know, you can pull that in without revealing particular. You know, I want to just emphasize that point about not reaching out to the city and you know, exposing private information. But again, from that standpoint of how to keep both individuals and property safe. But yes, agree with Kris that I think certainly worth more. Okay, so Stephanie said, what if it's a private landlord with no subsidy? How would others chime in on that one?
That's a tough one, Stephanie, because they're not obligated under VAWA at this point in time, and so you don't have that sort of that tool at your disposal. What I might suggest is doing some outreach and education with the landlord, because my assumption would be that if one tenant is experiencing domestic violence, that there might be other tenants who are experiencing it, and one of the tools that we have found useful at DASH is simply developing relationships with landlords and educating them about how to ensure safety for survivors who are living in their properties, both so they can make sure that their properties are protected and kept well, but also to make sure that their tenants are safe. And then acting effectively as that sort of broker between tenants and landlords to help mitigate circumstances that might come up around domestic violence in their properties. But it's a long-term strategy, so it's not an immediate solution for the kind of situation it sounds like you're dealing with.
Well, and I do think that the relationship building is kind of your first step, because you don't want to pull out the hammer right away if you don't have to, but that might also be a fair housing law violation. And so if you have a fair housing association or fair housing agency in your town, or if not, a legal aid organization that can help you explore whether or not whatever behavior is happening falls under fair housing, it could be something that you use as a follow-up if VAWA doesn't apply.
Right, and Sarah Watson recommended, is there a local attorney who has expertise in landlord-tenant issues, provides free consultation, or an organization that can help with survivors too? So I think that's a really a good suggestion as well. So a follow-on to that question is, what is a suggested approach for involving or not involving landlords in safety planning?
Well, I think, again, that's a whole other webinar. We actually have a great recorded webinar about landlord relationships and building those relationships. But I do think it has to start with to what degree having that conversation with the landlord is going to expose the personal information of a tenant. So if the survivor is all behind, the effort to educate the landlord and have them be a more understanding aspect of, the safety plan and the healing that the survivor can experience when they have the foundation of safe housing, then I think you can have that conversation. And, Peg touched on this a little bit a minute ago, which is to create that basis of understanding in the landlord that safe housing is very critical to a survivor's ability to rebuild their life and establish that sense of safety and stability for themselves and their children, and that the landlord is key in that. And talking to landlords about how survivors want nothing more than to have safe and stable housing, and that they're a great prospective tenant because of that incentive, can really help. I think landlords, when they understand more about the impact on credit and on lease history and so forth that a survivor might come in with, just as a DV 101 education can often help. But again, it's got to come from a place, if you're advocating on behalf of a particular survivor, of the survivor's consent and willingness to have that, just the fact that they are a survivor, sharing that information is confidential information and could really, not be what the survivor wants to see happen. You can do landlord education apart from advocating for a particular individual. So if your agency wants to begin cultivating more relationships based on a fuller understanding in the landlord community about domestic and sexual violence dynamics, you can do that anytime, regardless of whether there's a particular individual that you're advocating for with that landlord. So I think the cultivation piece, and including, many homeless and housing agencies do a lot of landlord cultivation. So including domestic and sexual violence education component in that cultivation could be a great addition to what you're already doing.
Exactly. Thank you. Emily, do you have anything to add to that?
No, I think I was just reflecting on the shared objective idea that, landlords, what do they want, right? They want permanent tenants, that property isn't being destroyed, police aren't coming to the unit, that sort of thing. And so to whatever degree that shared objective can be, part of this dialogue, both short-term and long-term. I do think if you have somebody that is in harm's way by the landlord, and it is a private landlord, we're all about relationships and making something work, but if safety is an issue, it may be time to look for landlords that are more interested in that cultivation of a relationship. I know that's easier said than done when vacancy rates are low in those communities, but
Exactly.
I wanted to point that out.
Great. So another question that came up is, what are some best practices for home visits with survivors where safety might be compromised or the abuser may be present?
Oh, that's a great question, and that's a huge area about which we have lots more information through Safe Housing Partnerships. There are some great home visiting safety protocols available. But I'll say in a nutshell that one of the most important aspects of best practices for home visits has to do with that relationship and the conversation. Again, it's not a checklist, it's a conversation that you have with survivors ahead of doing a home visit. Now, you may walk into a situation inadvertently where you're doing a home visit with a domestic violence survivor because that is not some information that you have before you do the home visit. But if you do have that information ahead of time, then having a really thorough conversation with the survivor about whether that is going to be a safe and private place for you to have the visit. First, you want to consider whether a home visit is a good idea. So together with the survivor, you kind of be walking through all the different aspects of that. And I think even more important than, just as fruitful as talking about the safety is talking about the privacy. Are we going to be able to have a conversation where you can really fully participate based on who might be in the housing if I come and do a home visit? And that can include a roommate or, children who might be out of school that day or, any number of other possibilities. So talking about the safety and the privacy of the time that you're going to spend together. And then thinking about the things that we touched on some in the webinar. How are you going to introduce me to your neighbor? If your neighbor sees me at your front door, how should we describe why I'm there? And so talking all that stuff through ahead of time is really integral to doing home visits safely. Making sure that you have a cell phone charged and ready with you, that somebody from your agency knows where you are. There's many, many different aspects to a safety planning protocol, and you can find more of that information through the website. There's also, we recently did 2 offerings of mobile advocacy with domestic and sexual violence survivors webinar, and so that's recorded and available. And so there's a PowerPoint and a recording that you can look to find more information. So there's plenty of ways to find out more about that, in addition to some responsive technical assistance. If you want to reach out for some one-on-one conversation about that, I'm more than happy to have that conversation with you, to look at where you are, what your policies are now, what might need to be shored up, and how you can better ensure that both the survivor and the service provider are going to be safe in those situations. And there are just some times where home visiting is not a good idea. So that's one of the options available too.
Great. Emily, do you have any thoughts on that?
No, I think I posed that question because I wanted to get the group going to talk about it. But yeah, I think home visits, certainly within your agency as well, talking about safety planning for your staff, and if people need to be going in pairs or how they need to be communicating to each other. So we get very focused on the the safety of the survivor, of course, that's our goal, right? But, you know, how are we also making sure that staff are not putting themselves in compromising situations? So I think that's just something that all agencies need to consider what their policy is for that.
And in
Right,
most cases,
that could be
planning,
another.
I was going to say, in most cases, safety planning with the survivor is also providing safety for the advocate, because the survivors in most cases will not want to bring an advocate or a case manager into a situation that doesn't feel safe and doesn't feel private. So focusing on one allows you really to focus in and expand your focus to both ends of that relationship. Yeah. Thanks, Emily.
Great. So I guess one last question. How, and this should be fairly, I think, straightforward, how do we do safety planning if someone doesn't reveal that they're experiencing domestic violence?
Yeah, I think that's tough because you don't know whether to get into, you know, detail about the context of that person's situation if you don't know what the situation is. But I think, as I said during the webinar, putting out the signals that you're aware of the fact that safety issues is part of what many people that you work with are dealing with. And so sometimes you're doing safety planning just by saying something rather than asking something. So if you are tuning in to the fact that many people experience, you know, danger in their homes, and there may be some risk sometimes that people feel when they're out in the community, or, you know, I think you can say some things that signal that you're tuned into safety. And I think if you have a way to make the availability of safety planning something that you can offer to everyone in your program, you know, everybody needs to think about safety in their life, and it may in some cases be because of domestic and sexual violence, but it may be because the streets aren't very safe or the neighborhood doesn't feel very safe. So mentioning safety planning as part of the conversation that you have with all your participants could be a way to draw out some of that information. And I think it's fine if you don't hear it at first, because there's trust building that happens over time. If you're putting the signals out there and you're laying a good foundation, sometimes, as I said, more will be revealed. And then you can get into some of the details of what particular opportunities for reassault or danger might exist in that person's life, and how you can build in as much safety as possible to avoid those.
Great. Right. Are there any other final points that, Kris, that you would like to make, or anything, Emily, that you would like to add before we wrap up?
I would just say that just to be paying attention for the deep dives, because I think some of the questions that came up in the chat box are certainly worthy of more troubleshooting together as a group. So I just wanted to put a plug for that.
Fabulous.
Yeah, and you took mine, Emily. I want to really invite people that want to continue this conversation to one of the deep dives. And one of the things that we found in those deep dives is that there are often resources, and I saw a little bit of that in the chat box just today, people who have figured something out that can offer that solution to other people. So you all can be resources to one another in the vast majority of cases, and it's great to see people sharing what they've learned in those deep dives, where there's much more opportunity for interaction than there typically is on a webinar. So y'all come.
Great. Well,
look at
that's
it like
it
you're
for
from the
Q&A.
South.
All right.
All right, well, I just want to say thank you again to our presenters today, and to NCJ, FCJ for hosting this webinar. and to remind everybody that we will be sending up follow-up information along with the presenter contact information, recording of the webinar, and PowerPoint slides, and then some of those links to resources that Kris and Emily and Peg have mentioned throughout the presentation. So thank you all for attending.
Thanks, everyone.
Thanks, everyone.
Thank you.